We are having a good time. Don't stop us now because we are now plenty of calories, especially plenty of energy to continue. So yeah, so now we are going to change a little bit the topics, no, that we have been seeing until now. We are going to go to these AI and then mental health topics, and I'm going to introduce you the first speaker. That would be Adele Williams. That she maybe can help me with this a little bit irreverent avatar that I have, that appears from time to time. Maybe you can help me with her. So, Dr. Adele Williams from the UK is an artificial intelligence and clinical data expert in the vet profession. She is an equine internal medicine specialist, having a PhD and worked in various veterinary academic institutions. Adele has led the creation of AI tools in the pet care space and getting data right for building AI tools and getting meaningful insights out of data. She works as an AI and clinical data consultant to veterinary profession, where she educates veterinary professionals and advises veterinary business on AI and clinical data. And she also advises veterinary technology startups on development and deployment of the vet tech products. So it's a pleasure for us to have you here, Adele. So just a big applause for Adele. Thank you.
Now can you hear me? Ooh, yes. Okay, right, let's see if I can get this pointer to work, shall we? Okay, so thank you for having me here today. So these are my individual opinions. So first of all, it's such a big topic, where to start. So what is AI good for? AI is really good for automating repetitive tasks, and it's really good for analyzing large data sets, and that can be complex data sets, and giving you insights into that data. So how could that apply in the veterinary field? How can we use that in veterinary medicine? So we can use it to improve efficiency by automating tasks that are boring, are tedious. We can use it to improve patient care, perhaps by analysing complex data sets and giving us answers on clinical questions. And we can definitely use it to manage our businesses better by combination of those two things, automating tasks and analysing data. So I just want to give a bit of a disclaimer that I've been asked to give this talk and make it interactive and give some examples. So I show lots of examples of AI tools within the veterinary space and outside of the veterinary space. These examples I provide for demonstration. It is not a personal endorsement. And if you are going to start using an AI tool in your veterinary practice, you need to do your research. You need to look into the data safety, if the outcomes are reliable, and what the risks are of using the tool, as well as the benefits. So although I'm going to demonstrate these things, it is not a personal recommendation. And you also need to think about the legal and ethical implications of using AI and what you're going to say to owners if you're using AI to help make diagnosis in their pets. You need to think about what's happening to the data that you're feeding to this third party that's not your data, it's the pet owner's data or the pet's data. So I think they're really important considerations when using AI, but I haven't got time to talk about all of that in this talk. Okay, so next. No. Okay, so there are two sort of general types of AI, and we can split this into predictive AI. So this is the more traditional model of AI, which has been around for many years. It's mathematical models looking at outcomes of things. So an example of this, Mars have recently released Tooth Scan, which is a tool for owners to take a picture of their dog's mouths. And the tool has been trained on a specific data set of images of dogs' mouths that have been labelled according to the disease status of the mouth, gingivitis, tartar, plaque buildup, etc. And the prediction that comes out is based on the AI's analysis of the image that the owner uploads. So this is predictive AI. It's very reproducible in its output each time that you get an output, because it works in one particular way. But it can be prone to bias. So if the data set contains 90% gingivitis cases, it's going to look at an image and predict that it's gingivitis because it was trained that 90% of things are gingivitis. Okay, so there can be bias in this kind of AI tool. The other kind of AI is generative AI or Gen AI, and ChatGPT is one of these. And these are what's caused the media storm about AI and or the wave and the hype that's going on about AI at the minute is largely to do with the generative AI. So generative AI is trained on a huge data set, and by huge I mean everything that's on the internet. I mean, it's just enormous amount of data. We all know that there's good things and reliable things on the internet, but there's also unreliable sources of data and false things on the internet as well. So you can imagine that sometimes the outputs are great because it's trained on such huge data that if it has access to that information, it can give you reliable outputs, but also sometimes the information can be false. What they generate depends on the type of model that it is. So often they're used to generate text, and these also employ large language models, which make the text sound very human-like, very conversational in the way it comes out, which is why people have been blown away by the outputs that these things create. And they also, when they produce the output, the text, it's very human-sounding, it's very believable. And sometimes it's complete nonsense. It's made it up, it's a hallucination, but it sounds very believable. And I think that's where we have to have caution when using it in veterinary medicine, because something sounds like it's true, so you believe it, when actually if it's helping you make a diagnosis and it's just completely made it up, that's really dangerous potentially for our patients. So there's two examples of very famous generative AI models here, ChatGPT and Claude. There are others on the market, and there are free versions and there are paid for versions that can do more. They can be very useful, but you also have to be careful about what's happening with the data that you're feeding in, because these generative AI models, they create things. The output isn't just a prediction, it's a creation of something, be that text, an image, or a video. So anything you put in has the potential to come out at some point later in time. So if you're putting client-sensitive information in there, big danger, big red flag, be careful. So that's just a word of caution with my responsible use hat on. So that's the general gist, very, very high level of the two different types of AI model we're likely to encounter in veterinary medicine. But how about AI use every day in veterinary clinics? And I'm going to walk you through now the pet owner journey. Oh, sorry, I didn't mean to spit on the microphone. The pet owner and the pet journey through a veterinary clinic, and places where I'm going to give examples where AI could be used or is being used, is available to help us with that journey. So if we think about, first of all, the pet owner interaction and what the pet owner thinks of the veterinary clinic before we even get into the veterinary clinic. So the veterinary clinic, oh, the pointer doesn't really work. No, I'm going next, sorry. Pointer? Oh, yes, it is slow. The veterinary clinic is a physical building, but it's also the online presence of the veterinary clinic. And many of our clients are technology adapted these days. And so there are ways that we could be utilizing AI to interact with our clients before they even come into the clinic, and to help. There's often a blocker, say a client rings the practice and they want to get through to reception, and the person on reception is taking all the phone calls, doing all the billing, signing people in, dispensing medication, all of those things going on. So there are AI tools that can help in all of these situations. So they can help from the, I don't really want to use the pointer because it's not working. Pointing up there. So from, let's say an owner wants to book an appointment, why not use an AI tool in an app or on the practice website to help book the appointment, rather than them having to go through ringing, waiting to talk to reception, the phone line being busy, freeing up the receptionist to do other things that are perhaps more useful in the clinic. How about some basic triaging and actually saying how important a call is and how urgent that appointment needs to be, and also collecting some basic data, some pre-history collecting before the client comes in to see you, the vet, and that will save some time and help you understand what's going on with the case. So let's talk about, go next now. Okay, so this is an example of a taking some customer information and sort of triaging. This is a tool called Your Vet Box, and it's listening to what the owner is saying, asking some basic questions, and this is running through. It's got the information and what the pet owner wants to happen, and the AI is sort of automating, clicking the answers here. So this is a cat, a male cat that's had a change in urination, and it's changed activity levels, and it's urinating outside in unusual places, and straining sometimes to urinate, and it's less playful. And so the AI agent says this sounds like it could be an emergency. So it's sort of triaging that this isn't something on a Friday that will wait till the Monday because it's probably a blocked cat, and this needs to be seen sooner. So really helps those situations where the reception team wouldn't necessarily be trained or remember to put high importance on that, and this tool can help sort of with the triaging and level of importance for appointment booking. So another example, this is PetsApp, and another sort of front of house tool for helping managing your appointment bookings and things. And the owners have an app which they can talk to and interact with your vet clinic. Will that play? And so the owner says that the dog's been vomiting, and then it sort of has some conversation with the owner, suggests that they should bring it down. The owner says, I don't really want to, and then it goes through and actually urges the owner to make an appointment. And then it's actually connected to the practice management system, and it looks for the appointment slots, offers a variety of times, and then books the appointment, which is pretty smart, isn't it? And that takes away from the conversation that would otherwise be had with the reception team, and they can be getting on and doing other stuff. So it also puts notes into the clinical records so that the vets can see what's going on. So that's that one. Got a lot of videos to get through, so I'll try and go on. This next one has got audio. So this is a telephone conversation with the veterinary clinic with a client. So let's see if this will work. No audio.
Yeah, I just got a text message reminding me about Ziggy's vaccination being due, so I wanted to book an appointment for him.
Of course, let me check the available appointment for Ziggy's vaccination. One moment, please. I have several slots available for Ziggy's vaccination. Would you prefer an appointment on the 7th or 8th of February? We have options in the morning.
I think the 10th would be better.
On the 10th of February, we have availability at 8:15, 8:30, 8:45 and 9 o'clock a.m. Which time would you like?
I'll take the 9 o'clock one, actually.
And then that's the
Ziggy's
appointment.
vaccination appointment is booked for the 10th of February at 9 a.m. We look forward to seeing you then.
Thanks so much. See you then.
I love how people are always polite to AI. I find myself doing it all the time. Thank you, you've been so helpful. So that's great. Next one. So then let's get the pet into the veterinary clinic. There are tools that can help check in the patient. We've got digital technology tools that can help do that. They go into the waiting room, and then the vet calls them in to the clinic, into the consult room. In the consult room, the vet chats with the owner, takes a history, does a clinical examination, and then they turn around and type. And you can't hear me because my back's turned to you, so they turn around and type their notes about what's going on. So there are wonderful things in the consult room now that can help us with that. And let's go on. So this is quite a long video. I might have to, we'll play it, but there are these tools now, and there's more and more coming out. This is just one example, which is a very good example, in my opinion, of ambient listening scribe. So it listens to the conversation that you have with the client in the consult room. Best to ask the client if it's okay to record them before going ahead and recording them, for legal reasons. But it listens and records the whole conversation. which is really good when you get a disciplinary case and the client saying that you didn't say that. Actually I did, because it's in the recording. But more than that, it's not just a dictation. It takes in all the information that you have said and then summarizes it into succinct, nice ordered notes that you can then copy and paste into your clinical records, or in some even smarter tools cases, the copying and pasting is done for you directly into the clinical records. One thing that I would say about this type of transcribing tool, and I'll play the video to really demonstrate its power in a minute, is that there is a large language model generative AI behind it, and sometimes they do a very good job, but sometimes they make things up, they hallucinate. So sometimes they say things that you didn't say. They suggest differential diagnoses that weren't in your conversation. And therefore, you must, as the veterinarian who's responsible for writing the notes in the clinical record, which is a legal document, you must check through what has been written, and you must make sure that it is in your words and things that you would want in the record before you save it permanently in the record. The nice thing about these things is once the notes have been typed, you can change it as you like and then copy and paste. So they're really good for you not turning your back on the client so that you can focus on the client and speak to them. They're also really good because to make sure that you get really nice notes, you start vocalizing your clinical examination much more clearly and explaining, I'm looking at his eyes now. I found this when I'm listening to his chest. I found this. His temperature is 38, which is completely normal. You don't need to worry. And because you're vocalizing all of that because you want the notes to be better, the owner gets a much better experience because you're actually engaging with them and explaining everything in a much more thorough way than you would do before. And you haven't got to worry about the time at the end of the consult when you've got to type all this stuff up because it's being typed as you speak to the client. So this video is a little bit cringy because I obviously couldn't record a real consult. So I've recorded myself interviewing myself as the client. So let's go for it, shall we? Hello, Miss Williams. Who have you got today? Is that Da Vinci? Yeah, this is Da Vinci. He's 9 years old. Okay, can you tell me a little bit about what's been going on with him? Why have you brought him here today? Well, he's got a bit of an upset tummy. Right, okay. Has he been vomiting? Yeah, he has. How many times has he been vomiting? Oh, he was twice yesterday and once this morning. Okay, and has he had any diarrhea at all? Yes, he had some diarrhea this morning as well. Okay, and was there any blood or any mucus in it? There was a bit of mucus in it actually, yeah. Okay, and how is he in himself? Well, he's a little bit, I think he's a bit off colour. He's not been as happy and he's been sort of lying down and a bit moody all day really. So I'm a bit worried about him. Okay, yeah, that's certainly a reason to be concerned. Let me have a look at him then and have a look what's going on. Okay, so I'm just going to do my clinical examination, just starting at the nose end. He's got a nice shiny nose. His gums, looking at his gums are a nice pale pink colour, and capillary refill time, which is the reperfusion time, is within normal limits. It's 1 second. His teeth have got a bit of a build-up of plaque and tartar on them, but we can talk about that at another moment. We'll just focus on what's wrong with him right now. I have a horse vet, by the way, so this might not be accurate.
His eyes, I can't see any abnormalities there. Just have a quick look in his ears. Yeah, they seem to be nice and healthy in appearance. I'm just going to have a feel of his glands. They feel okay under his neck, his glands there. Okay, so I'm just going to have a listen to his chest now. Yeah, okay, so I'm listening to his breathing on both sides, and his breathing rate is a nice normal rate. And I'm just taking his heart rate now, and his pulse is 60 beats per minute, so that's normal for him. And I can't hear any abnormal sounds in his heart or his chest, so that's great. Just gonna have a feel of his tummy. Oh, he is a little bit tender in his tummy, isn't he? Yeah, bless him. Okay, all right then, mate. Well, now's the not quite so nice bit. Hold on, DV. We're just going to take your temperature,
I'm just going to put the thermometer in his bottom. Okay, his rectal temperature is 39 degrees C, so that's getting towards the top end of normal. So, what do you think it could be? Well, I think he's got a bit of an upset tummy. He's got a bit of gastroenteritis. Is he a scavenger? Does he tend to get into bins or pick anything up on walks? Or do you know what? He did actually get into the bin a couple of days ago. Right, well, that's probably what's going on here then. Probably not to be of concern. He's likely to get better. What we'll do is we'll get him on a nice bland diet. I'll give you some prescription food for him. And I'll give you some probiotic paste to give to him as well. Make sure he's got plenty of water. If he starts throwing up loads more, if his diarrhea doesn't get any better, or if he gets worse or you're concerned at all, I want you to come back tomorrow or call the emergency team in the night if you're concerned overnight. I think that hopefully this is just an acute case of eating the wrong thing and upsetting his tummy, and hopefully in a few days' time he'll be feeling much better. Okay, that's really great. Thank you very much. So then I press generate. Okay, so then generate from library. And they've got a library of different templates that you can choose from, depending on the type of consult that you've done. And that's just sort of scrolling through to show you the different templates that there are. Just so. Okay. That's all my different patients. So we can search for it as well. So click just the SOAP one, which gives subjective, objective assessment and plan. And then it will generate it when I get around to clicking generate. And it takes a few minutes to think about it. Perhaps should have edited this video a little bit and made it a bit shorter, sorry. I hope that as an equine vet, I've done an okay job on a small animal gastroenteritis case. At least I didn't give it antibiotics, right? So then you can see that what you get is a subjective section and an objective section where it talks about the different assessments. And it pre-populates information where you haven't said anything, and then you can change it if you decided that you did see something that wasn't there. It looks at a plan and anything additional going on. And then you can email it to yourself, you can copy and paste it, there are some Google Chrome extensions that allow you to put it directly into the PMS. So yeah, so it's pretty neat. We'll come back to this tool later because there's more that we can do with this. So I'll have to point at this, I think. Can we go next? Yeah? I need to be more affirmative in my pressing. Oh, no, too much to go. Yeah. Okay, so we've had the consultation and then our brains are whirring and we're trying to think about everything that we need to do and if we need to do any diagnostic tests, if we need to prescribe any medication, if we need to admit for an inpatient, if we need to do surgery. There's all loads of different things we could be doing. And basically there's AI tools that could help with nearly all of these things. And if there are AI tools that are available now, there'll be probably more and better AI tools available in the future with a higher degree of clinical accuracy. So there are tools to help look down at microscope slides and tell you what's on the slide. That's really useful, right? Nobody likes doing manual cell counts. If you can get a tool to do that for you, brilliant. If you can get a tool to tell you what the cells are that you're not quite sure what they are because you're not a clinical pathologist, also pretty cool. But you do need it to be, you need to be sure that it is telling you the right thing. And that's where the sort of caution comes in using these tools as diagnostic aids, and think about the case in front of you and whether the picture fits what the diagnostic aid tool is telling you, in the same way that in any diagnostic test has a sensitivity and specificity, and you would be aware of considering the test results in the bigger picture of what's going on with the whole patient and not just take the test results in isolation. The same goes for clinical use AI tools, that you should consider what's going on in the whole patient and whether the test results actually reflect what you're suspicious of. So there are AI tools to help with interpreting imaging. There are AI tools to help write your prescription, to help you calculate your drug dose. Okay, and what you want in something that's helping you calculate your drug dose is not something that's going to hallucinate and tell you the wrong dose. Okay, so that's really important to remember. There are AI tools that can help with your inpatient monitoring and recognizing pain in your inpatients or in your outpatients. Let's say you want to know how they're doing post-operatively when they go home, and if there's an app where an owner can take a picture of a cat's face and it will score the facial expression of pain and then send it to you, then you can be alerted to if there's a change in that facial expression of pain and say, hang on a minute, we need to see you back in here. So there's all of those. Let's look at some examples. So this is a clinical decision support tool by a company. It's called VetGenie. It's actually licensed on the Wiley textbook. So it's a large language model, but it has been trained specifically on all of the information in all of the veterinary textbooks that have ever been published by Wiley. So that's pretty smart. And it's not going to go onto the internet source data. It's going to use this data specifically. So that is sort of targeting its information from trusted sources, if you can trust what's in the textbooks. Which is a sticking point, because with any AI tool, the quality of the output is dependent on the quality of the input. And so if anybody can actually write a textbook, and so we treat them as the gold standard, but are they actually? And I suppose the one sort of negative side of this, because it's referencing textbooks are set in time, and therefore they don't always contain the most up-to-date information. So the more recently published information is not going to be in textbook data. But this tool does all kinds of things, and it also pointer. Probably difficult to read because it's tiny writing on this screen. I'm trying to point at the top, the right-hand column. I've sort of got there. There we are. This information is telling you the exact source of where the data has come from that the tool is given you. So that's pretty smart, right? And there was a vet that's behind building this, which I always like when the AI tools have a vet that's a co-founder or in the senior leadership team, because you know that they're really involved in the product development. Whereas there are also many software companies, and some of them good and some just out to make money from the veterinary industry, that don't necessarily have any clinical decision making in the senior team, which is a bit of a flag to me sometimes. So then, sort of looking at cytology, we all know who Zoetis are. They have got AI tools now in their diagnostic thing. I speeded up this video because it was too slow. It's on their website. But this is looking at fecal parasites, egg counting, and doing it in a non-manual way. I mean, who likes looking down a microscope at poo? And recognizing that blob is an egg and that blob isn't an egg, and the different types of things that the eggs are. So I think that's a wonderful thing. And the Zoetis range covers all sorts of different things that you might do in cytology, including looking at urine sediment, as well as poo analysis and hematology analysis as well. So there's more and more tools, and Zoetis is just one example. There are more coming. And this is a type of tool that has been trained in that narrow training kind of way, the predictive AI, where it's predicting that what it's looking at is likely to be this. Okay, so less likely to hallucinate because it's not got the generative AI side to it. And and more easy to be validated because the outcome is predictable. You can find out what the sensitivity and specificity are for these tools. Next, radiology. There are numerous companies available that are now veterinary specific imaging support. This is Radimal, again, vet co-founder in the team. What I like about this is that it also is connected to specialists if you want to discuss what's going on with and help your interpretation of the images. So I think that's a really nice example of not just using AI in isolation. And that's sort of looking at what it thinks is there on the radiograph and telling you about it. So that's really useful. The feedback that comes from people in the field that have the early adopters of AI imaging assessment is that in the veterinary field, often we're not quite there yet and the results can be disappointing. So again, that comes back to the quality and the quantity of the training data. And we need good quality training data and lots of it, because you need lots of examples of every single different possible scenario you might see on an X-ray for a tool to know what it's looking at. But there are instances now in the human field, which we always lag behind slightly, where it soon will be considered negligent to not consider what an AI says about a radiograph. You don't have to take the AI's judgment as gospel because you're the clinician, but to not use it and have a look and consideration of what the output is going to be negligent. Certainly in the UK, that's coming in. So these tools will get better, and they will be brilliant to help us. So I talked about assessing facial expression of pain in cats. Really important. Our little cats are often not well considered, are they? And so it's really important to recognise when they're expressing pain. This is a tool from Sylvester AI, where owners or vets nurses in a clinic can take a picture of the face and get an assessment. That was very quick. Can we go back? Can I play the video again? If I go back again. There you go. So it's taking a picture of the face and then giving an assessment and saying whether it thinks that there's expression of pain in that cat's face, which is great for, as I said, at-home monitoring as well. So next part of the journey, tell me how I'm doing for time. I do have a tendency to talk too much, and I've got a lot to say about AI. So sort of after at the end of the consult, and we've made some decisions, and we perhaps want to prescribe some medication, we want to do the invoice, and then the patient goes home, and the owner's actually got some more questions, wants to interact with us again. So how about client follow-up and how we interact and collect data about how the pet is doing once they've left the clinic? Because I think if we put our hands up, there'd be a lot of hands saying that we're quite poor at collecting post prescribing information. For example, you prescribe something, you say to the owner, let us know how it gets on, and then they go away. Do you follow it up if they don't let you know? Unless they've got an appointment booked, we tend to be really poor at collecting the outcome data. So let's have a look at some examples here. So this is back to the CoVet, the scribing tool that I demonstrated before, and this is when it's done the thing, and I want to get the billing information. So here we can go on to, once we've done the recording, the billing information, I want some summary, and I want to summarize everything that I did to create the bill. And it will generate it. And it gives a list of all the procedures it thinks you've done and all the materials it thinks you've used, which can help. I think that potentially veterinary clinics lose money from people forgetting what they've done, or and being rushed when they're doing their invoicing at the end of the consult. And this acts as a reminder if nothing else. And this technology will evolve so that it sort of automatically clicks the stuff within the PMS and does the billing for you, and then you just have to check that, yes, that was what you did. So isn't that a great time saver, and also better for the health of the business, because everything is being charged for appropriately. So then this Pet Scribers is a company that are helping with prescription support, and they have a tool coming out which will help writing a prescription. So for those clients that don't want to buy the drugs from you at the clinic, but they want to go online and source them cheaper, isn't it a pain when you've got to then write out the prescription and you've got to write all the details in it and everything? And this tool will help streamline that process and make it so much easier, and send it off to the online pharmacy so that there's no risk of the owner sending the prescription to 10 different pharmacies and getting 4 years worth of drug supply, but also that it saves time in the consult room, helping the prescription to be written. So that's another great example of a support tool. And then also looking at inventory and stock control. Who likes counting pills? Nobody. Wouldn't it be great if there was an AI that could look at the stuff that you're buying in, know what's on the shelves because it's linked to your PMS and the stuff that's been prescribed, and has an automatic count of what is left on the shelves, and also what's about to go out of date, what there's a lot left of, could flag that there's actually loads of this stock left on the shelf, let's do a promotion. Or let's educate the staff about this needs to be used, and help sort of control the stock control a lot more. So this is one tool called Inventory Alley. I'm not super familiar with it. I'm sure that more tools will come out, but there's some wonderful things here where it's sort of saying how much is in stock and when it's going to go out of date, and I think that's really, really useful to be tied into the PMS information. And then coming back to Covet again, showing it a few times, but there are quite a few useful things in this in the transcribing tool world that are really useful. And this is you have a consult, you say a load of stuff to the owner, they go home, they can't remember any of it. Okay, or they can remember one thing of the 10 important things that you stressed to them, and they were upset and they were worrying about the dog at the time and stuff. So that it's really difficult for them to remember everything. If you can provide them notes, then that will help them immensely. But if those notes are in veterinary speak, it's not going to mean anything to them. If you put D+++, HR 60, etc., they're not going to understand that. So these transcribing tools can automatically translate what you said into owner-friendly speak, and then you can give them a PDF, or you can email it to them, or you can print it off for them to go home with so that they can reference it, or even better, save trees, have it on an app that they can access at home, and they can see their pet's data at home. So just an example here of this. So I want to create a summary for the owner based on the conversation that we had in the consult. And this is sort of real time, so it's showing you how long it's taking to create it. There we go. We saw Da Vinci today because he was experiencing an upset tummy. It's nice owner speak. It's a nice summary. What I found on the physical examination, what my diagnosis is, what the medications to go home with are, and other treatments and care instructions and signs to watch out for, and any follow-up steps. I can change this if I don't agree with what it's written, but that saves phenomenal time, right? The other thing that I haven't included in all these videos, but is summarizing medical notes as well. So particularly for those of you that are in referral practice, you can use some of these tools to summarize a 20-page history that's just a printout, from a referring veterinary surgeon into notes that you can understand. You mustn't trust it completely. It might miss stuff out, but for you to get the gist of something, in the 2 minutes before you see the client, it really helps you sort of summarize that. So it's a really useful tools, and lots of different use cases in a clinic. Then for follow-up, there's a front of house tool called ClinicWise, similar to Pets app, and they allow you to do post-appointment follow-up, contacting owners by text message, by WhatsApp, to ask them how the appointment went, and actually then get the data that you can put back into the PMS and have it in the records. Also sort of looking at if you want to market clients about particular promotions, perhaps you want to market to a segment of clients. Let's say we want to talk about dental procedures to Chihuahua owners because they're going to need lots of dental procedures, then we can select that subset of owners and market directly to them, so it's more personalized marketing. And that brings me on to AI in the business and marketing, and understanding more about the data that we have in the clinic. We have vast reams of data that we do nothing with, and we generally perform average at best as businesses, and we don't talk to the clients in the way that they need to be talked to. Their pets are individuals, they are individual owners, and they have individual needs. They don't all need mass blanket emails about chocolate toxicity in dogs when they're cat owners, for example, which is very broad, but you understand what I mean. So there are tools to help with this. So this is a company, ABC Intelligence, which have a product called Vet Genus, and these are two examples of marketing campaigns to owners, one on kidney disease, one on cardiology, where it's selected out animals with these specific things in their medical history to target them and boost product sales for particular things that will be of benefit to the health of those pets. And then there is another company called Looper, who have an AI native practice management software, which has lots of really nice tools on it. But this I've highlighted here is sort of an automatic data dashboard where you can go in and see things about how the practice is performing in terms of consults, the types of consults that are doing best. I cannot hardly read it myself. So, but sort of on the list here, there's consults and animal health certificates, booster vaccinations. They're sort of listed as the top performing consults for this practice. So it's sort of really giving a breakdown of different elements of the practice, of what's going on in the consults, to give you a much better idea of what's going on, which can help with targeted marketing. It can help with educating vets on what's going well, what isn't going well. It can help you do antibiotic use monitoring, for example, and looking at who's prescribing for different things. And this is information that we should be looking at easily, and it's actually in most practice management systems can be very difficult to get hold of this information without following some complicated steps, getting a CSV file, opening it up in Excel or Google Sheets, and then analyzing the data yourselves. It shouldn't be difficult. You should be able to get to the insights straight away. So that's where AI can be really useful. And then last example, I don't know how I'm doing for time, probably hugely over, sorry. This is, I'm using Claude, which is just an AI tool that there's a free to use version. This is the paid, I think I pay $20 a month for this, so it's not extortionate. And I'm going to give an example of creating social media content. So I am manager of a veterinary practice. Gosh, I'm slow at typing on my clinic. Help me to create a social media campaign ahead of Easter to warn dog owners about the dangers of chocolate. To do that. Now, how long would it take you or a vet nurse in your practice or the reception team to write some stuff? It's coming up with the key messages. It's giving you a calendar of contents and times to which to release it. It's got a plan of the awareness, building the awareness, and what you're going to release on the Monday, the Wednesday, the Friday. You know, it's phenomenal. This is recorded in real time. I haven't sped this up, the stuff that it's coming out with. It's giving me some sample posts to put on social media. It's giving me some ideas for the visual content. It's telling me which hashtags to use, how to implement this media campaign. And then it's then it goes a bit off because I ask it to produce some visuals, some infographics, which I thought that it was going to be really good at, and they're actually they're a bit pants. But we'll I'll show you just what it comes up with, just for completeness. So it actually produces the code, because Claude's very good at coding. So it produces the code to produce the images, whereas there are other image generative AI models that don't give you the code. They just produce the image and perhaps better quality images than the image you're about to say. But why not use one tool to produce the content, another tool to do the image generation? You know, there's no reason that you have to be loyal to one. They have no feelings. But you do have to be polite to them. So yeah, you can see the images that it's producing are actually shockingly bad, but there are better versions. I think I'm going to stop the video there because I'm conscious of time. And just to re-highlight what I said at the beginning about the challenges and the ethical considerations with AI. So we don't have really any regulation of AI tools in the veterinary space. There's huge regulation of medical devices in the human space, nothing really in the veterinary space. And in the EU, you have the EU AI Act. If you look at the wording, it's all focused around danger to humans and human health. There is nothing about animal health in the AI Act. And in the USA, there's the FDA are supposed to oversee veterinary medical devices, but in reality, they don't. Have huge concerns about data leaks and privacy concerns and what's happening to that data that doesn't belong to you. It's your client's data that you are feeding into a third party, and make sure that it's trusted and the data isn't going to go and be used for training AI models elsewhere, or who knows what's going to happen to it. Beware of bias. So if there's bias in the training data, there's going to be bias in the output. Hallucinations, making stuff up that sounds really convincing. And the variable outputs. So if you ask ChatGPT to do something for you and you don't like the answer, you can just ask it to do it again and it will give you something different. And if you ask it 20 times, it will give you something different 20 times. So not necessarily reliable. And then, you know, environmental concerns, the energy use of using AI is phenomenal. The water use that goes into cooling down the large GPU processors for this isn't without consideration. So if there's something that you can get the information on a Google search, perhaps you should stick to doing a Google search sometimes and not always get, jump into using AI. So I think using it ethically and responsibly. The other side of AI concerns, I think, is very valid, that people are overwhelmed. There's so many tools. How on earth do we know what to choose? What do we go for? It's overhyped. There's all these companies claiming all these things, but can they really do everything that they claim? And perhaps there's huge marketing ploys there and sort of overselling stuff. So check that they can do what they claim to do. How on earth do I assess it? Well, you could ask somebody like me to help you with that. But sort of really pay attention to read the terms and conditions and the privacy policy and look at what's happening to the data. Ask them for the sensitivity and specificity. How reliable is this tool? Really get your information before just choosing to use it or forcing vets in your team to use it. Also, what are the team's concerns? So if you're a practice and you pay a lot of money for this nice subscription to an AI tool, it's no good if all the team are fearful and they're not going to use it. So you have to also manage the team and convert people into using AI and get them happy and excited about it. Again, I can help with that. And providing training. Some of these things are intuitive, some of them are not. And some things, even though they're intuitive, they still need training on. So you can, even though ChatGPT says it is not licensed for use as a medical device, you can go in and ask it medical questions and it will give you medical answers. Okay, so training of the team that they shouldn't be trusting the answers necessarily that come out because of the potential for hallucination. Having perhaps a practice policy on AI use. There's a term that I've started using, which is bring your own AI, whereas the practice as a whole doesn't have a policy on AI use. The people in the consult rooms are using AI tools on their phones. They're putting the practice's client protected information into an AI tool on their phone and then putting that into the system. So think about having a practice AI policy if you're involved in that sort of thing. So to summarize, where does AI have a place in veterinary practice? Pretty much everywhere. Apart from the human touch and the physical stuff and that bond that we have actually with the client as well as the pets or the animal, depending on your type of practice. So AI has lots of places and can be really useful and can actually help our lives be better by taking away the stuff that is a pain to do and actually engaging with our clients better than we could otherwise, and actually improving our relationship with our clients as well. So in conclusion, I've sort of concluded already, but Use AI for improved efficiency and for data-driven decision-making, enhanced customer engagement. Use it for improved clinical outcomes. I think that we're still on the fence there. These tools need to be improved and trained on really high quality data to get really high quality clinical tools. Use caution using it. And when you start using it, start small. Start really small. Use it, practice using it, just have a go and do your research. And I'd like to say thank you. You can use the QR code to connect with me on LinkedIn. My website address is there as well. I'd like to do just a small plug for FlareVet, which is a veterinary community. We do live streams talking about the problems that we as veterinarians and vet nurses see in the veterinary profession and how we can deal with them, largely focused around mental health. And it's a largely North American team there, and I'd like to get some more European speakers and people engaged on that community. So please join that. Thank you.
Thanks a lot. Thank you a lot, Adele. It has been a really, really nice lecture. So don't go. Because we want to know if there are some questions here in the audience. No questions? I think they have indeed a lot, but maybe they are still processing all the info. So, okay, so I have one question. So we have seen really nice tools here, right, that they have their own link, let's say, to go, but the vets usually they are working with a program, no, their own vet program for managing in the clinic. So how easy is to link somehow this with the program, or to make it really easy for them to go to these tools?
I think it really depends on the tool, and quite often the tools when they're first released don't necessarily have very good integration, and then as the software companies get more funding, then they can work on developing the integrations with the practice tools as they exist. So I think that's really important, that if it's not a perfect journey at the minute, then in the future it can be. Because they're working on integrations. And so a lot of the tools are working on integrating, so sort of API connections with practice management software, so that it's all integrated and in one place, which makes it a lot better, because having to have like 10 windows open on a browser causes a headache.
Okay. Any other question from the audience? No, still not. So, okay, I will do one more. I will, here, okay, because if not, I will take the advantage.
I thought it's going to be somehow, some of the AI tools have a really, really high level of confabulation. You said it already, but it is usually also given as a percentage. I have already seen in my market in Poland the AI-driven posts and articles that had a really major mistakes in veterinary words. So it means that someone published something before reading, or I don't know, let it to somebody who didn't have the knowledge to check, to proof check the text. So my question is, what is probable level of this confabulation? Because I heard that it's 60 to 70%.
So
in nutrition, for example, barf is the best way you can feed your dog.
Yeah, so the question was about hallucination rates and people not proofreading stuff and putting erroneous information out. I suppose that there's 2 points to make there. One is it's really critical to maintain a human in the loop. So making sure that somebody does read content before putting it out there. So the example that I showed of Claude making a campaign for Easter, the person who was in charge of social media posts should then read through that information before posting it on a live website which the public can view. Second, in terms of the rate of hallucination, for the large language models that are largely used in the transcribing tools, for example, it's about 80% accuracy. Now, accuracy is a very difficult word, because accuracy in terms of software development is completely different to clinical accuracy. So about 20% of stuff is made up. They are iterating on the large language models, and I would say that figure is from some point in the middle of last year. And of what I have experienced myself of recent times is that the hallucination rate is far lower now than the sort of 20% of stuff is made up. For example, I use deep research in ChatGPT to do analysis of data of a topic. Let's say I was interested in looking at whether track wash or bronchoalveolar lavage is better for diagnosing asthma in horses. I asked it a question and it went away and it looked up lots of sources of research papers and analysed them and gave me a very thorough and comprehensive summary of all of the literature that's out there, and was able to critically appraise it. But there was one article, which the article was real, but the authors were completely made up. And it's that kind of level of misinformation.
Yeah. So, okay, so thanks a lot, Adele, because we have run just out of time. Thanks a lot. It has been amazing. I think that now we have a lot of doubts, but as well, it has been really nice. Thank you.